For more than 4 decades, Long Far Temple has built a reputation for sheltering psychiatric patients. It hails from an earlier age when there wasn't universal health care and the options for the mentally ill were few. The temple's background and unconventional methods have kept it outside the normal treatment system. But recently, it has made dramatic reforms in an attempt to qualify for public funding and support. Tonight, we examine the progress it has made. Our Sunday in-depth report.
Led by Shih Hsin-hsien, the director of Long Far Temple, we visit a place well known for supporting mentally ill patients. In 1970, Shih Kai-fong built a temple in his hometown of Kaohsiung County's Lujhu Township. He decided to name it Long Far. Initially, Shih Kai-fong was entrusted with the care of one mentally ill patient. Soon his reputation spread, and others sent their mentally ill family members here. Long Far became synonymous with a shelter to take care of the mentally ill, and today it has more than 600 residents. It believes that each person is a member of the temple and each has a special story.
Before sending my brother here, he almost burned down our house. At night, he took some medicine and was preparing to go to sleep, but he was hungry. He turned on the stove to cook, but the medicine took effect and he went to bed. He left the gas on and the whole house was full of smoke.
We would be responsible for any effect his actions had on our neighbors. From my experience, this burden is too heavy. It's something the average person can't handle.
Instead of charging fees, Long Far relies on donations from family members, a policy that has eased the burden on lower-income families. But over its 4 decades of service, the temple has not been without controversy. One issue involves its earlier use of metal chains. In the beginning, Long Far used chains to join patients with slight mental disabilities to those with more severe disorders. The chains were meant to help patients overcome problems.
He used this method on patients who would urinate and defecate everywhere. We taught them until there was a breakthrough. We took them to the bathroom and told them to use the toilet. When they finally did, we were delighted.
They have a nice name for this chain, but in reality it's dangerous and deprives the patient of basic human rights. It limits movement. When 2 patients are chained together, if one has an episode, it can lead to violence and murder.